Ayon, and my topic is Escherichia coli. Definition. Several types of E. coli exist as a part of the normal flora of the human gut and have many beneficial functions, such as the production of vitamin K2.
And behind it will be these long strands that are the bundle-forming pilus. They're going to adhere to the microvilli, these wiener-like structures. This is what your normal intestinal cell surface comes along here. Bacterium then causes these things to disappear. It then starts to nestle down on the surface. It's locked in. And then it's going to come down, and it's going to set up camp right there. We know that happens because we can see this in electron micrographs, and the microvilli all disappear, and boom. Okay, so we're now stuck in the intestine. Bacteria are here. We're going to zoom in. Here's our type 3 secretion system. Right, this thing will poke out. We know a protein comes out. We know this protein. And then it inserts two more proteins that come out and down this tube, and they go into insert into the host membrane. So these green proteins will sort of form like a donut pore. This is kind of the tip of the syringe.
The symptoms. The patient will typically experience symptoms with 3 to 4 days after being exposed to the bacteria. However, in some cases, they may appear with a day or a week later.
It includes severe stomach cramps, diarrhea, and vomiting. If there is fever, it is usually not very high. Most people get better within 5 to 7 days. Some infections are very mild, but others are severe or even life-threatening.
The signs. The signs are abdominal pain, diarrhea, nausea, vomiting, fever, and fatigue.
Other symptoms may include anemia or kidney failure, which could lead to death. At Terry Bryant Law Offices, we're committed to improving safety and holding those responsible who cause harm to consumers. If you suspect you've been affected by a foodborne illness, feel free to call our office for a free
The cause. The cause: ingesting contaminated water, ingesting contaminated food, having physical contact with animals, high fevers, and high fever diets.
E. coli are a large and diverse group of bacteria. Although most strains of E. coli are harmless, others can make people sick. Some kinds of E. coli can cause diarrhea, while others cause urinary tract infections, respiratory illness and pneumonia, and other illnesses. Still, other kinds of E. coli are used as markers for water contamination. Some kinds of E. coli cause disease by making a toxin called Shiga toxin. The bacteria that make these toxins are called Shiga toxin-producing E. coli, or STEC for short. The most commonly identified of these in North America is E. coli 0157H7. When you hear news reports about outbreaks of E. coli infections, they are usually talking about E. coli 0157. In addition to E. coli 0157, many other kinds can cause.
The risk factors: certain foods, immunocompromised patients, stomach surgery, and the person's age.
People of any age can become infected. Very young children and the elderly are more likely to develop severe illness than others, but even healthy older children and young adults can become seriously ill. The symptoms of these infections vary for each.
And the complications. The vast majority of infected individuals make a full recovery within a week. However, susceptible individuals mentioned above may develop hemolytic uremic syndrome.
An outbreak of E. coli in central Japan has claimed its 4th victim. A total of 66 food poisoning cases have been reported, with 3 deaths. The cause of the outbreak was a raw beef dish served by a Japanese restaurant chain. The beef contained E. coli strain 0111, which produces verotoxin. When verotoxin enters the intestinal tract and enters the bloodstream, it can cause hemolytic uremic syndrome. Verotoxin damages the layer of cells that lines the inner side of all blood vessel walls. This causes internal bleeding throughout the body and can lead to low platelet count. Verotoxin is particularly damaging to the kidneys and can can lead to acute renal failure. Antibiotics cannot be administered because they may stimulate further rare toxin production. Dialysis treatment and blood transfusions are used instead. The mortality rate for cases of hemolytic uremic syndrome is around 10%.
Diagnosis. The doctor identifies the sign, asks the patient about symptoms, and sends a stool sample to a lab for analysis.
If they drink water from private water supplies. We know that in Grampian we've got a large number of people on private water supplies, especially in Aberdeenshire. And again, people can actually take relatively simple steps to actually reduce their risk associated with private supplies. If you think your property is on a private supply, what I suggest you do is you get in contact with your local environmental health officer, who will provide you with advice around how you can improve the quality of that water and whether or not you need to have some form of treatment on it. So by taking relatively simple steps, i.e. washing your hands and actually thinking about the activities that you do in the countryside, and also to think about the quality of your water supply, you can actually reduce the risk of actually acquiring this infection.
In treatment, the patient should avoid taking OTC medications for diarrhea. Also, this will slow down the digestive symptoms, undermining the body's ability to eliminate the toxin fast enough.
The specific treatment will depend on the type of infection. There are no current treatments that can cure E. coli 0157H7. It just has to run its course. Cystitis infections usually go away by themselves after a few days. Sometimes a short course of antibiotics may be prescribed. Most doctors advise patients to drink plenty of water to avoid dehydration and get lots of rest. A sample of feces should be sent off to confirm that it is an E. coli infection. Any contact should be screened, and the patient should be off work or school until the infection has cleared. With regard
Prevention. Cook meat well, especially ground meat. Rinse, wash vegetables, store food separately, and hand hygiene.
To help prevent the risks of E. coli outbreaks, keep good hand hygiene, particularly after using the toilet and before preparing food. Wash fruit and vegetables, particularly green leafy ones, to remove excess dirt, reducing bacteria. Cook meat well, especially ground meat. Drink pasteurised milk, as it is safer than unpasteurised. Wash cutlery and crockery thoroughly in warm soapy water. Make sure you store food separately. Don't store raw meats next to other foods, and use separate chopping boards. Some people have been infected by swallowing the water from swimming pools or playing in the lakes or ponds. So swallowing water during these activities.
E. coli are friendly bacteria too. E. coli bacteria may also be friendly bacteria. Research from Coli University grow in Nature Chemical Biology. The bacterium can produce sugar-modified proteins, which allow for the production of cheaper and faster pharmaceutical drugs.
Also known as E. coli, is a bacterium commonly found in the gut. Several types of E. coli exist as part of the normal flora of the human gut and have several beneficial functions. Most types of E. coli pose no harm, except for serotype 0157H7. This can cause food poisoning in humans and can become life-threatening. A healthy adult will normally make a full recovery from E. coli 0157H7 within 5 to 7 days. However, young children, elderly adults, and patients with